Let us go to pattern discrimination. The topic is Tcm pain discrimination. TCM frequently associates various specific pathogenic factors, pathological conditions, and patterns to pain development. At the same time, it is possible to support diagnosis and treatment of different patterns and pathological conditions according to the different types or qualities of pain. Moreover, different types of pain itself could be approached and treated differently according to TCM discrimination. Discrimination of pain according to different pathogenic factors. So here we look at the pathogenic factor, the quality of pain, and the accompanying symptoms. So for the pathogenic factor of wind, the pain will be moving, wandering, erratic or migratory, changing quality, abrupt onset, acute, and paroxysmal. And that symptom is aversion to wind, slight fever, floating pulse. When there is cold, the quality of pain will be fixed, sharp with stiffness, and the accompanying symptoms will be improved by warmth and movement and aggravated by cold and rest and tight pulse. If there is heat, there will be a feeling of warmth, redness, and swelling and difficult movement. There will also be fever, aversion to heat, thirst, irritability, restlessness, and rapid pulse. When there is damp, the pain will be very localized and does not move. There will be heaviness, numbness, deep, heavy, and dull swelling without edema, and appears gradually, and it is chronic. And the accompanying symptoms will be aggravated in damp weather, heaviness, tiredness, especially in the lower part of the body and limbs, and slippery pulse. When there's chi stagnation, the pain will be moving, diffuse and distending, and soft. The symptoms will be aggravated by emotional disturbances and bowstring pulse. When there's blood stasis, the pain will be fixed, stabbing, hard, and refuses pressure. The symptoms will be worse at night. There will be purplish discolorations, purplish tongue, and choppy pulse. So here we'll look at the quality of pain and the major pattern correspondences. If the quality of pain is sore, then that is a deficiency of qi and blood. If there's distending pain, it is qi stagnation. Stabbing pain is blood stagnation, which is an after effect of physical trauma. When there's sharp pain, it's an acute qi stagnation and blood stasis. When there's throbbing pain, it's hyperactivity of liver yang or toxic heat invasion or accumulation. When there's burning pain, that's an invasion of exogenous wind heat or internal heat. For colic pain, that's invasion of exogenous cold or accumulation, and stagnation of qi in the small intestine, gallbladder, or uterus. And it's a substantial blockage such as stones, sand, stagnant blood, or phlegm. When there's a whole body pain, that is a pattern of excessive factors such as qi stagnation, blood stasis, or accumulation of damp, and qi and blood deficiency. If there's wandering pain, that could be painful obstruction primarily due to wind invasion, qi stagnation, and mostly in the abdomen and chest, and it is closely related to emotional changes. When the pain is in a fixed location, that is blood stasis, where there's invasion of exogenous dampness or damp accumulation. When there's pain with spasm, it's an invasion of exogenous cold or wind cold or liver blood deficiency. When there is a pain with a suffocating feeling, it is qi stagnation or damp phlegm accumulation. There's painful obstruction in the chest, combined qi stagnation and phlegm accumulation. When the pain is radiating, that is qi stagnation and blood stasis. There's accumulation of stones or sand in the bowels, and there's liver and gallbladder qi stagnation. When there's pain with contraction, it's an invasion of exogenous cold. There's formation of deficiency, cold, and congelation due to yang deficiency. When there's pain with heaviness, it's an invasion of exogenous dampness and damp accumulation. When there's pain with swelling, it's blood stasis following trauma and damp accumulation and toxic heat. If it's pain that refuses pressure and massage, that's excessive factors like qi stagnation, blood stasis, cold accumulation, and food stagnation. When there's pain that is relieved by pressure and massage, that is the deficient factor, like qi or blood deficiency or yin or yang deficiency. When the pain is relieved by warmth, it's an invasion of exogenous cold, formation of deficiency cold, and congelation due to yang deficiency. When there's pain relieved by cold, that's an invasion of exogenous heat or heat accumulation. When there is a constant pain, that is an excessive factor. An intermittent pain is qi, blood, yin, or yang deficiency. Thank you so much for your attention.